Good morning, and welcome to another edition of Medical Minutes, brought to you by Passavant Hospital. I am Dr. Peter Russotto, your host and moderator. Today, we have the pleasure of talking with Lisa Pennell, RN, nurse manager of the newly remodeled and renovated specialty clinics here at Passavant Hospital. I asked Lisa to be here to discuss all the services that are offered by different medical specialists participating with the specialty clinics. Sometimes the people in our listening audience really do not know all the services Passavant provides to our service area. I believe today's discussion will open our eyes to the vast array of specialty services Passavant does strive to provide. First of all, I want to thank you for coming, Lisa, and I also want to welcome you. We'll start with the very first question is basically what are and what is the specialty clinics here at Passavant?
Yes, the specialty clinic is a clinic that we offer at Passavant. It's really an area that we can have multiple physicians or multiple clinics going at the same time. And it's been newly renovated, and it allows for different disciplines or different physician groups to come over and actually see patients at Passavant that we wouldn't be able to have if we didn't have that space for them. And it's just really important because at Passavant, we are so wanting to service the patient with whatever we can, and we really want to try to allow them to be able to stay in the community to receive those services. So it's just a great place where we can offer that for all our consumers and patients.
So basically it's an area set aside at the hospital with exam rooms and medical equipment for all the different specialties, subspecialties, or whatever type of clinic we want to offer, correct?
Yes, exactly.
So why did Passavant decide to have the specialty clinics?
Like I said, I think the main focus is really about the patient or the person that needs that to see somebody. We wanted to make sure that we were offering everything that we could offer here in Jacksonville so that people weren't having to travel or be inconvenienced by having to see a specialist or receive treatment somewhere else. They could just stay right here in our community.
Well, it's an added benefit, like you said, of convenience, and I believe also to coordinate the care with their primary care physician because they'll be right there close to the hospital. So it's a good communication between the specialist or whatever the clinic is and their primary care physician.
Yes, that does work very well for us.
So where exactly is this specialty clinic located at the hospital?
Well, for people that have been around the community for a long time, it used to be in the building that was the dormitories in the old School of Nursing. That whole area has become more like clinic type things, and it's considered like the east building of the hospital. It's the building that's kind of in the middle that has the new glass elevator that you can see there from Walnut. We're located on the second floor in that building. It's got its own entrance and everything there in that building.
So when they're parking to go to any of the specialty clinics, it would be more on the east end of the campus, correct?
Yes.
And you're saying it's elevated. Is it on the first floor? I don't even know myself.
It's on the second floor.
And it's an elevated, so that way people with any type of disabilities would not have to worry about circumventing stairs or anything, correct?
Yes, there's a glass elevator right in front that you can get on and go to the second floor.
In the specialty clinic, I'm sure there's many different specialists and services. Can you tell the listening audiences what are the services that are presently provided in this clinic?
Yes, we have several different groups that come over. We have a cardiology group, that's cardiovascular consultants. They come over there several days during the week. We also have nephrology and dialysis services, and those are physicians from Central Illinois Kidney and Dialysis Associates that come over and they see patients. We have pulmonologists that comes over from Central Illinois Allergy and Respiratory Services. Dr. Crabtree sees patients there at the specialty clinic. We do have oncologists that come over and see patients from the Simmons Cancer Institute at SIU. They come over and see patients. We're now offering, which I'm real excited about, is a congestive heart failure clinic. We have a nurse practitioner that comes over one day a week, and she sees patients in this clinic, and this allows patients to be managed more closely when they have congestive heart failure or if they have a family member that has congestive heart failure. We offer that service to just kind of continue to monitor them and do follow-up for them. So we're very excited about that.
basically, the way I hear it is this specialty clinic, there might be other specialties or subspecialties added in the future. It could be changing certain days, I'm sure, because sometimes practitioners decide, well, I used to come on Monday, Wednesday, and Friday, and I'll come on Tuesday and Thursday. But I'm sure the patient will be notified of such, correct?
Yes, the offices are very good about contacting their patients and letting them know when a change like that has occurred because, yes, that could happen.
Well, say a patient does have a question that they want to talk to somebody about or you about for the specialty clinics. Are there any contact numbers you want to give out?
Sure. The number for the specialty clinic is 479-5511, and anybody is welcome to call if they have questions. We will be more than happy to try to direct them in the right way and make sure that they get all their questions answered.
Now, you did mention a little briefly about the new congestive heart failure. Is that going to be by referral, or is it going to be by that the patient themselves can call and make an appointment?
Yes, that is by referral. It takes a physician referral to be able to come into the clinic. So if somebody knows of somebody that could possibly benefit from that, they just need to get with their primary care physician or whoever's managing their congestive heart failure and get that referral, and then we'll be more than happy to see them.
Well, that's been great information. I just wanted to get it out to the listening audience that Passavant, like you said earlier, is always striving to meet the needs of the community. We want to be a convenient hospital. We want to offer multiple disciplinary services in the medical profession such that the patient doesn't have to travel and, like I said, coordination of care with their primary care physician. Is there any specialty thing that you needed to talk about or add that I didn't actually ask you a question about?
No, I don't think so. The main thing is if people do have questions or just want something that we could maybe help them with, they can give us a call at that 479-5511, and we'll be more than happy to try to assist.
Well, thanks again for coming and discussing this with us, Lisa. I thank the listening audience for tuning us in, and good health.